Hi there, my beautiful friends. Welcome to Hive. I'm Lorena, and this is our Tuesday talk. Menopause is having a moment right now, and not just because of the hot flashes. It's in the news, it's all over social media, and more women than ever are finally talking about it. But here's the problem. There's more information than ever, and also more confusion than ever. So today, I want to break it down, what's actually happening, and what you really need to pay attention to. Let's start with the biggest shift in the conversation. The real hot topic right now isn't menopause, it's perimenopause. This is the phase of years that lead up to the 12 months of menopause. And here's the part no one prepared us for. It can last for years. During this time, your hormones aren't steady, they're fluctuating. I like to call it hormonal turbulence because that's what it just feels like. Everything is shifting, moods are shifting, body weight is shifting, everything is just turbulent right now. And this is where a lot of women start to feel like they're losing themselves when really it's just their body changing the rules. Over the past 90 days since early 2026, advancements in perimenopause have shifted toward earlier intervention, recognizing symptoms in women as young as 35, and treating the transition as a comprehensive neuroskeletal reset than solely a reproductive one. Key findings highlight that symptoms like anxiety and fatigue often preset the more known symptoms like hot flashes, night sweats, things like that, while new FDA label changes in February of this year, 2026, have significantly altered the landscape for hormonal therapy, HRT, or bioidentical BHRT access. So let's talk about hormone therapy now that it's making a big comeback. FDA updates boxed warnings in February of 2026. In a landmark change, the FDA updated labels on 6 hormone replacement therapy products, including Bijuva and Divigel, removing the boxed warning regarding risks of heart disease, breast cancer, and dementia. This update aims to encourage early treatment within 10 years of menopause or before age 60. For years, women were told to avoid it completely. But now that conversation is being reevaluated. What we're seeing today is a more personalized approach. Things like patches, gels, and individualized dosing, instead of a one-size-fits-all pill. And because more women are learning about it, there's actually been a surge in demand. So much so that some forms, like estrogen patches, have had shortages. That alone tells you women are actively looking for solutions. Now, hormone therapy is not the right choice for everyone. Some women can't take it, and some women simply don't want to. And that matters because every woman still deserves relief. That's where newer, non-hormonal options are starting to finally come into play. There are now prescription treatments designed specifically for hot flashes without using hormones. The FDA recently approved Linkuet for treating moderate to severe hot flashes, and that offers a non-hormonal, non-antidepressant option that can show results within the first week, ladies, 1 week. And while these aren't the answer for everyone, they are at least expanding the conversation and giving women more choices. Research now suggests that psychological symptoms such as anxiety, depression, and irritability often peak between the ages of 41 and 45, well before the physical symptoms like hot flashes, night sweats, things of that nature, that blech feeling, which typically peak later. So redefining the diagnostic framework shows new studies indicating that moderate to severe vasomuscular symptoms and vaginal dryness are stronger indicators of early perimenopause than irregular cycles alone. Experts are advocating for a hybrid diagnostic model that includes symptom patterns, even if periods remain regular and stable. I'm hopeful that this will lead to more meaningful conversations in the doctor's offices beyond "it's just aging" and walking out of the clinic with a prescription for an antidepressant or an anti-anxiety med. The brain-bone connection. Perimenopause is now understood as a systemic, metabolic, cardiovascular, and cognitive reset. Research from early 2026 shows that fluctuating estrogen affects brain connectivity, particularly in memory circuits. Why did you walk in this room? Because you have perimenopause. The new perimenopause definition, that narrative is shifting from symptom management to a new perimenopause decade, where early intervention can manage the pro-inflammatory state of the transition, which affects brain health, metabolism, and bone density. Now let's talk about what women are really dealing with, because it's not just those hot flashes anymore. Yes, they're still common, but the conversation has expanded. We're hearing more about things like brain fog, trouble focusing, memory lapses, mood swings, irritability, even what some women are calling menopause rage. And then there's the weight gain, especially around the middle. So if you've been feeling like "I don't recognize myself anymore," you are not alone. And more importantly, you're not imagining it, despite what one or more doctors may have told you in the past. Now here's where we need to pause for a second, because menopause has become a market. If it can be a commodity, they're going to find a way to do it. And there are more products than ever being targeted to women in midlife. Supplements, skincare, gadgets, programs, all promising to fix your symptoms. But here's the truth. Just because something is marketed to midlife women does not mean it's backed by science. So this is where I always encourage you to slow down, ask questions, and make sure that what you're investing in actually supports your long-term health. Keep in mind, your hormone balance is what helps symptoms the most. Treating the symptoms without fixing the root cause is like putting bubble gum on a hole in your tire. And this leads to a really important issue, the medical gap. Many women are still being told, "You're fine, this is just aging, come back if it gets worse." But what we're learning is that many providers have had very little training in menopause care. So women are walking away from appointments feeling dismissed when they know something has changed. And that's a problem, because you deserve to be heard and you deserve real answers. Now, here's the good news. Things are changing. Women are speaking up. Conversations are becoming more open. We're not ashamed of it. We're not, oh, I'm fine, when we're not fine. We're talking about it finally. Even workplaces are starting to recognize the impact menopause can have, and that matters, because for too long, women have gone through this silently, and this is not just a trend. This is a turning point. And finally, we need to talk about the bigger picture. Menopause isn't just about symptoms. It's about long-term health. I've said it time and again. Everything we're doing here is to set us up for success. As estrogen declines, it affects things like bone density and heart health. So this isn't just about getting through menopause. It's about how you support your body for the next 30 or 40 years. So yes, menopause is finally being talked about, but what I want you to remember is this. You don't need more noise. You need the right information. You need support that actually makes sense for your body. And most of all, you need to know that you are not alone in this. So that's all I have for today. But before I go, remember, you are strong, you are vibrant, you are charming, and you are loved. I'll see you soon.